Value for money is about the comparison of the value of something with the money it costs. Value for money means maximizing the impact of each pound spent to improve poor people's lives. Value for money is not a separate issue at all. Achieving it emerges from good project design, procurement, and management. The DFED approach is about having more explicit analysis, discussion and communication of value for money, both internal to DFED, to senior staff and ministers, and external to parliamentarians and the UK public. We get value for money by buying inputs of the required quality at the lowest price, producing outputs of the required quality at the lowest cost, and how well outputs produce outcomes. We will draw good practice from wherever we find it. We need to share value for money good practices. For example, minimizing training costs by using a trainer of trainers approach, building capacity of government and community groups to deliver services to ensure sustainability.
When I first started working with the GPC project, one of the first things I noticed was they were so much engaged in the development of manuals to develop one tool or another and trying to come together as a consortium.
By sharing tasks, working together and building on each other's strengths in terms of value for money, bringing in approaches and guidelines and formats and all the minutiae of a program and putting them on the table, I think it is actually more cost effective than trying to design something from scratch and to start from a baseline of zero. So I think the consortium has proven to be different than other consortium, and I think as well it has been able to deliver on the value for money expectations that we all had.
Every organization brings their own experience, their own support. Second is the value for money, because all the organizations are squeezing the operational cost into their own structures, so we can have some savings.
But in this case, it was the community, the VCs, that implemented the project, because the village councils have been capacitated. Other future development activities, the communities can then take ownership, can then implement the projects themselves, and we're already seeing that happening.
My role in making sure that communities do not depend on care or any other agency is to make sure that they participate from the beginning, which ensures that they have ownership in what we are planning, what we are implementing, and what we are thinking in the future.
The challenge continues. Build a robust and defensible case for how an intervention balances economy, efficiency and effectiveness and delivers the most value for poor and marginalized people.
Thank you.